Hello, my name is Ryan Kaufman. I'm the Tobacco Policy and Control Program Manager for the Philadelphia Department of Public Health. Today, for the Running Start Health Family Health Training Academy, I'll be providing a short presentation on how you can help those you provide care, services, and treatment for to become tobacco-free and to quit smoking. An overview of this presentation is the hope is to engage staff who help serve clients with tobacco use disorder to advance their recovery from tobacco use. Hope that this presentation will increase the comfort level and competency of staff to help those that they serve recover from their tobacco use, prevent youth initiation of tobacco use, knowing that youth are more likely to begin using tobacco if they see adults around them using tobacco as well. And a lot of the resources that I'll be sharing can also be beneficial, not just for those that you serve, but if you are also working on your own recovery from tobacco use, this can assist staff as well. An important starting point for this conversation is just to focus on how devastating to human health tobacco product use really is. So a lot of folks know that lung cancer, for instance, or throat cancer can be caused by tobacco use, but there is a whole host of other impacts on the human body, not just in the form of cancers, but also chronic diseases. They're either caused by or worsened by tobacco use. So in short, tobacco use damages every part of the body, inside and out, head to toe. This is important when we talk with clients that we're serving, that it's not just about one's length of life that is impacted by tobacco use, but also one's quality of life. Tobacco is a leading killer of Philadelphians. This is data that we have available showing that tobacco use is the leading killer and causes more deaths even than drug overdoses, alcohol use, and gun-related homicides combined. The effects of tobacco, as I mentioned earlier, aren't just limited to one's physical health or wellness. This is a diagram that shows, developed by SAMHSA, which shows the 8 dimensions of wellness. That wellness, argued by SAMHSA, is not just the presence or absence of illness or disease, but is all these different facets of wellness that comprise or make up the whole individual. I think there's a very good point to be made that tobacco use undermines or negatively impacts almost every area of wellness. So for instance, beyond physical wellness, the financial impact of tobacco is substantial. A pack-a-day tobacco user of a premium brand of cigarettes in Philadelphia will spend almost $4,000 a year just on tobacco use, which leaves less money available for healthcare, education, food, clothing, housing, and other important areas in an individual or family member's life. It's also very important that we reframe and rethink the way that we define tobacco use. Far too often it's referred to as a habit, when in actuality tobacco use disorder, as it's diagnosed, is a chronic disease and a substance use disorder. It's really a treatable chronic relapsing condition, very similar to diabetes, hypertension, or substance use disorders. And we know that relapse can be a part of recovery or management. Just like someone may not manage their diabetes on their first attempt, or their substance use disorder, so too becoming tobacco-free on our first attempt can be difficult. But that doesn't mean that because relapse can occur, that promoting and advancing recovery isn't important. And we know, similar to other chronic diseases and substance use disorders, that treatment with a form of medication and behavioral treatment together is what can give people the highest potential likelihood of being tobacco-free and remaining tobacco-free. And we'll talk a little bit more about that later. As I just mentioned, tobacco use disorder is a physical addiction, and that's where we use medications to treat tobacco use disorder. It's also behavioral. This is what people refer to as the habit part of using tobacco. Other smokers, coffee, stress, talking on the phone, etc. So it's been shown very widely that treatment should address the physiological and behavioral aspects of tobacco use disorder to increase the rates of recovery for individuals with tobacco use disorder. Here's some examples of some of those behavioral resources that I mentioned. There's a lot to go off of. So this is a one-page flyer that we created in the Department of Public Health, available in a variety of different languages, that highlights some of the key web resources, text messaging-based resources, and telephonic resources, which are available to help folks begin their recovery from tobacco use. I'd like to focus just on one key resource here and talking about the Quit Line. This is a wonderful service, and we have a very well resourced Quit Line here in Pennsylvania. It's available nearly 24 hours a day in a variety of languages. They both are able to receive calls and provide calls to members of the public, and any Philadelphia resident any Pennsylvania resident may access this service. They even have text messaging support and professionals that are trained in treating tobacco use in some more vulnerable populations, such as those with behavioral health conditions or LGBT-identified individuals. And they offer free medications, several weeks, which one can access in concert with the behavioral support that they offer over the phone, or they can register online through PA QuitLogics, and there's a link there to access the medications directly if someone is not interested in initiating the counseling component of the service right away. So this is, months, several weeks to months of free nicotine replacement therapy that is mailed right to the house of the individual or the residence of the individual. It's a tremendous service and is a best practice evidence-based resource to help people begin their recovery from tobacco product use. Another resource that's also available is through our city health centers. So there are several trained tobacco treatment specialists like myself that are available at our city health centers that can provide one-on-one virtual consultations at this point in time to assist people directly with their tobacco product use. Any AHS provider can refer to these services, and someone has to be an AHS patient or willing to become a health center patient in order to access these services. We also have great coverage through the Affordable Care Act for both private and public insurance plans for tobacco use disorder treatment. And this is just a snapshot of some of the key plans and the extent of their coverage. And this is a one-page resource which is available for anyone listening to this presentation to access in order to know, as someone has insurance or is connecting with insurance coverage, what is available through their plan to help them become tobacco-free. Let's talk a little bit about the other side of the recovery that I mentioned, the medication treatment for the physical addiction. There are 7 first-line medications approved by the FDA to treat tobacco use disorder. And so many of these medications I mentioned are covered by insurance. Many of them are over the counter. There are some that are prescription based, but these have all been studied to be safe and generally safe and effective to use to treat the physical addiction to nicotine. Please note that e-cigarettes are not included in this representation of the different medications, as they are not approved at the current moment by the FDA as a safe and effective means for individuals to become tobacco-free and to quit smoking. It's a really important companion message to the medications that they are more effective when combined. So you may very well have a client who tried to use a medication to quit before, but says, oh, the patches don't work, or they weren't effective for me. What might be occurring is we need to combine that medication with another medication which can increase the rates of recovery from tobacco use over a single medication alone. And these are some of the combinations that can be used and have been studied to be safe and effective, such as the patch and gum and patch and lozenge, for instance. Let's then wrap up here to talk about if you have an individual you're working with and they express an interest in beginning their recovery from tobacco use, what are some of the key steps to help them get started? This is what I do with my patients when I meet with them at a city health center. I help them to set a recovery start date that they would target to become tobacco-free. I usually suggest something within the next 2 to 4 weeks. I help build up their social support by telling others, family, friends, coworkers, neighbors. This has been shown to increase people's rates of recovery from tobacco use if they have more people around them that are encouraging, supportive, and helpful in their recovery from tobacco. Help them develop coping skills for their triggers. So we know that people are going to get stressed and have to eat meals at times, whether they use tobacco or not, but helping really develop with that individual, what are we going to do in place of tobacco product use when we have those cues or cravings or triggers to use tobacco? What is it that's healthy and productive we can do in response to that situation rather than harmful and unproductive like tobacco use? And then have them remove all reminders of tobacco use from their home, vehicle, or work. Ashtrays, lighters, packs, empty packs. Have the environment that they spend the most time in, usually people's homes, vehicles, and work, totally tobacco-free, similar to if someone removed the presence of a substance like alcohol, for instance, if someone was in recovery from alcohol use disorder. And then talk to their healthcare provider. Could be their behavioral health or physical health provider about medication options that I mentioned earlier. And that could also be together with the quit line to identify a medication or medications that will work best for them. My last message to you is really, I think this comes down to a matter of perspective. Some of you may see this and say this is a duck. Others may look at this and say there's a rabbit, and you're both right. So I really talk to my patients when I'm working with them and thinking about stepping up to their recovery from tobacco use is viewing this as an opportunity, not an absence, not what they're being denied or taken away or deprived of, but what they're getting back from being tobacco free. And that's time, health, money, sense of independence, and self-control. It's like ending a bad relationship. One can still have feelings for someone romantically, but know that if I remain in that relationship, I'm going to be unhappy. The same is true for tobacco use. It can be scary to think about who am I going to be as a non-smoker? Who am I going to be as being tobacco free if this has been the way I've been living for sometimes decades of my life? But time does heal all wounds in a romantic relationship, and similarly, there are millions of people throughout the country that have become tobacco free and not only found being tobacco free bearable, but have actually found this to be an improvement in their lives that they're really happy about and proud of. That many of the cues and triggers, for instance, stress, are actually the problem, not the solution. When you smoke in response to stress, it's been shown that smoking does not relieve stress. Smoking just alleviates nicotine withdrawal. And often that feeling is mistaken for stress relief. And so though it feels like, for instance, smoking when I'm stressed is helping the situation, many studies and many people that I've spoken to who have become tobacco free report that their stress levels actually decrease or diminish after they quit smoking. They don't increase. And whatever someone's reason is, and that client you're working with, it's the right one. There's a whole host of reasons that people choose to be tobacco free. Some people it's the cost, some people it's the smell, some people it's a loved one or a child. Whatever that reason, and it's the right one, and we can work with that and help them move forward. And there's no lost causes or hopeless cases. No matter how long or how much someone has used tobacco, recovery is possible, but recovery that is built upon the best practices of using a medication for the physical addiction and a behavioral change or coaching and counseling approach for the behavioral part of the addiction is what's been shown to give folks the highest chances of success and to undertaking this really important step in their lives. I leave you with this message. This is from a former director of the World Health Organization. I think it's a great way to describe the urgency and the importance of addressing tobacco among everyone that we interact with and engage with and provide services for. That we're living in a moment in history when the call for social justice is echoing loudly, and by helping people become tobacco free, we are answering that call in helping advance and promote social justice, as well as helping people live longer, fuller, healthier, more productive lives in the process. This is my contact information here. Please feel free to contact me via email or via my office line if you have any questions or other ways that I can be supportive or helpful in your efforts to work with your clients on becoming tobacco free and quitting smoking. Thank you so much for your time and for your attention.